so I'm going to verify physician's orders, check for any allergies to iodine, betadine, or latex. I'm going to gather all of my supplies, make sure everything is in date, bag is intact, and make sure I have the right size catheter. I'm going to walk into the room, introduce myself. Hey, my name is Cassidy. I'm going to be your nurse today. The doctor's ordered a foley catheter placement, so I'm going to do that. I'm going to wash my hands, make sure the name, date of birth of the patient is correct on the armband, as well as the allergies. I'm going to provide privacy. If there was like a curtain or a door, I would make sure those were closed. I'm also going to make sure the bed is in the locked position, side rails are appropriate, and the bed is at a working height. I am going to put on non-sterile gloves and my goggles and put the legs in the dorsal recumbent position, and then I would perform pericare and then remove my gloves, wash my hands, and now it's time to insert the catheter. So first off, I'm going to take off the top part of the foley, or the foley bag, excuse me, and then I'm going to remove it from the package. And this is going to be my trash bag. Going to remove paper, stick that in there. Now I'm going to turn this, and then I'm going to open it. So it's going to be furthest away. Pinch this, open it furthest away, and then I'm going to open the sides, and tug it to make sure it stays down, and then I will put this piece up. Alright, now I'm going to put on my sterile gloves. Going to pinch the inside of the glove and slide my hand in. I'm going to apply the other glove, maintaining distance from my thumb. I'm now sterile. So now I'm going to turn this. I'm actually going to remove that. All right, so I've turned this. Now I've got to take my sterile drape and lay it shiny side down. Side down. Make sure it is under the patient's bottom. Still maintaining sterility. I would get rid of any extra drapes that I didn't need. Maintaining sterile field. Now I'm going to take off the top portion of my box and place it on the blue drape. Now I am going to attach my 10 ml syringe to my catheter. And carefully remove the sleeve over the catheter. Trash. Now I'm going to open my iodine sticks and place them on the tray. Around my sterile field. Now I'm going to put some of my lubricant out for my catheter. Throw that away. Now I'm going to tell the patient I'm going to touch her. So with my non-dominant hand, I'm going to grab the labia minora and majora and separate both. Now I'm going to clean her. The first swab, I'm going to do the outer, furthest away from me first. Swab once, discard. The second swab is going to be the side closest to me, swab once, discard. Then the third swab is going to be directly across the urinary meatus, swab once, and discard. Now I am going to grab the catheter and I'm going to very carefully lubricate it 1 to 2 inches. And I'm going to slide this up just a little. Being sure to maintain sterility. Now I'm going to tell the client to take a deep breath, bear down, and I've lubricated it 1 to 2 inches. Now I'm going to insert it 2 to 3, and then once I see urine, I will advance 1 to 2 inches more. So insert 2 to 3 inches, and then I see urine, so I'm going to advance 1 to 2 more inches. Now with my non-dominant hand, I'm going to grab the catheter and then I'm going to inflate the balloon. Now I'm going to gently let go and detach the syringe. I'm actually going to set my syringe right here beside so that I can use it for the catheter removal. Now I'm going to gently tug to make sure the catheter is intact and sitting on the bladder. And now I'm going to, with my dominant hand, I'm going to grab the catheter bag and place it to the side on the client's bed. Now I'm going to remove all of my equipment. And just for reference, the catheter wouldn't be dangling out like this. It would actually be seated in the bladder, so it would not be dangling down. Now I am going to remove all of this. Place it in the trash. That's my trash. Now I'm going to remove my gloves. I'm going to grasp the palm of the hand and pull down. and then slide behind this glove and pull out. So, remove my gloves. Now I'm going to put on non-sterile gloves, and I would stabilize the catheter. So I would either have a leg bag or a stat lock to put on the leg, and then I would hang the bag on a movable part of the bed, label the bag with date, time, and initials, and then I would do all post procedures, wash my hands, and then document. I would document the urine color clarity amount, the date and time, what I did, the size of the catheter, and how the client tolerated the procedure. To remove the catheter, I would need my goggles, pretend I have non-sterile gloves, a paper towel, well, a few paper towels, and then a urinal or a bedpan of some sort. And then I'm gonna perform, when I walk in the room, I would perform general procedures, and made sure my hands were washed. Put on my gloves and my goggles, and I would place a paper towel underneath the bottom of the patient, and then I would also place a paper towel underneath the foley bag, and then I would drain the foley bag and document the urine output and description of the urine color clarity amount, and then I'm going to disregard the urine in the toilet, and then if it was a male, I would bring the urinal back to the bedside, and if it was a specimen, I would leave it in the bathroom for a female. After that, I would wash my hands and then put on another set of non-sterile gloves, and then I would start the removal of the catheter. So I would remove the stat lock or the leg back, or the leg strap, excuse me, for whichever one they had on. And then I would take a syringe. Like I said, I already have a paper towel underneath their bottom. Take a syringe, attach it to the port, the same port that I inflated the balloon, and then I would pull back the same amount of fluid that I put in to inflate, pull back the same amount to deflate the balloon, and then I would ask the client to take a deep breath, bear down a little, and then as they were doing that, I would pull the catheter out, continuously balling it in my hand, and then dispose of the catheter. And I would have an extra paper towel sitting to the side to wrap around the catheter once I removed it, and then I would place it in the trash can. After that, I would provide pericare to the patient if needed. That's also one thing I forgot. After the insertion, I would also provide pericare to clean up any of the lubricant or iodine that may have gotten on the patient. So now after I provide pericare, I would take my non-sterile gloves off and my goggles, and then I would wash my hands. And then for post-procedure, I would have to tell the patient that they may experience frequency and discomfort after the removal. Call me or another nurse for the first time that they urinate so that we can measure it and document it. Drink plenty of fluids, and let one of us know if you have any prolonged discomfort for 6 to 8 hours after the removal of the catheter. After that, I would make sure that the post-procedures, patient has the call light, belongings within reach, beds in the lowest lot position, side rails are where they should be. And then I would document also, I would wash my hands, document date, time, what I did, urine color, clarity, amount, the education I gave the patient, and how they tolerated the removal of the catheter. After that, male catheter. So for a male, I would set everything up exactly how I would for a female, but he would be supine with legs separated slightly apart versus dorsal recumbent. And then I would tell the patient I was going to touch him, hold the penis at a 90-degree angle with slight traction, and then I would move the foreskin back if he was not circumcised, and then I would swab in a circular motion from the urinary meatus down the corona ridge, and then disregard. And then the next swab, I would go from the corona ridge down the shaft, take that, disregard, and then the last swab I would do directly over the urinary meatus. And then I would lubricate the catheter 5 to 7 inches, and then tell the patient to take a deep breath, insert the catheter 7 to 9 inches, and then once I see urine, I would insert the catheter all the way to the white port. After that, I would if I met resistance, I would slightly pull back and up and continue inserting. If the patient was not circumcised, I would put the foreskin back, and then I would secure the catheter either to the upper thigh or the lower abdomen, and then provide period care just like I would a female, and do all post procedures. Yeah, that's it.